Hi, I'm Bridget Lake, president of the Oviedo Winter Springs Regional Chamber of Commerce, and today we have our hospital update with COVID-19. We have AdventHealth, Orlando Health, and Oviedo Medical Center here with us today. Now, we waited for everyone to get in the room. It looks like everyone is here, ready to move on and get some updates and see what's going on with our hospitals in the area. Now, as we go through this presentation, we ask that you click into speaker view so that you're able to see who is speaking. And if you have any questions, make sure to type them in the chat box that is at the bottom of your screen. This way, when we get around to the questions at the end, I'll be able to read those questions off to our participants, which is AdventHealth, Orlando Health, and Oviedo Medical Center, and they'll be able to help us with those questions to get you answers. Now, before I continue, I would like to make some chamber announcements. We have our Chamber Resources tab, COVID-19, on our website, ovidowintersprings.org. What's great about this is it has some amazing details on information that you need to know or want to know in regards to owning a business or being part of a business. Another thing that people have been asking me is what is the chamber doing? And right now, the chamber is so essential. We are actually being an advocate for our businesses, and just recently, we are urging Congress to quickly bolster its commitment to the survival of small businesses across America by renewing the funding for the EIDL program and increasing funding for the PPP. This is actually been worked through the U.S. Chamber, the Florida Chamber, and chambers throughout Florida. So just so you know, we are here fighting for the business community. So I thank all of you for your support. I want to tell you about our discussion board for our members only. A great place to talk about some issues you may have, get some information. Our Facebook page is updated all the time. We actually just put some new information up there about small businesses and getting a $5,000 grant. The reason that we put it up there, and we understand that not every zip code is eligible, but us being a regional chamber, we understand that some businesses are not necessarily in our exact region, and we wanted to make sure that you had that information. I'd like to talk to you about some upcoming events. Tomorrow at 1 p.m., we have the Florida Executive Order discussion with Seminole County Emergency Management Chief Administrator Alan Harris. That is sponsored by Compassionate Cremations. And we have Monday, April 20th at noon, the Virtual Business Alliance. So that's great. We're getting our business alliances back in and running. And on Tuesday, April 21st, we have our Economic Development Committee, our powerhouse committee, really pulling together and helping support our chamber. So today's event sponsor is Compassionate Cremations, Banfield Funeral Home and Crematory, serving Central Florida since 1989, family owned by Greg Banfield and his son Corey. They established Compassionate Cremations 7 years ago and will be opening its newest location in Oviedo this summer. So we want to thank our sponsors. If you're interested in sponsoring any of our webinars, please reach out to business@ovidowintersprings.org. Thank you. And now this is the hospital update. Let me introduce our speakers. We have Caitlin Janetsko. She is with AdventHealth, currently serves as the Vice President and Chief Operating Officer at AdventHealth Winter Park, where she oversees hospital operations, ancillary departments, construction, and capital projects. She has worked for Advent for 9 years and previously served as the Director of Operations. In this role, she contributed to the planning and opening of the $85 million, 5-story, all-private, 140-bed new patient pavilion at AdventHealth Winter Park. Caitlin, thank you for joining us. How are you doing today?
Bridget, I'm doing well. Thank you so much for the opportunity. It's exciting to be here and looking forward to the discussion today.
Thank you so much. And we have Orlando Health, Sean Molsberger. Sean currently serves as the president of Orlando Health South Seminole Hospital and senior vice president of Orlando Health, and has served over 20 years of clinical executive healthcare experience. During his career, he has achieved success in clinical quality, patient experience, operations, and physician engagement. Sean began his career as an occupational therapist, earning a bachelor's degree from Utica College of Syracuse, and later an MBA in healthcare administration from Belmont University. Thank you for joining us today, Sean. How are you doing today?
We're doing good. Thank you guys. And thank you guys for all that you're doing for the Chamber and for just really the community. So we definitely look forward to talking today, because I know that a lot of people in the community have had a lot of questions about how things are going and seeing things that they've seen on the news, et cetera. So thank you for the opportunity.
Thank you so much, Sean. And we have Oviedo Medical Center, Kathy Droke. Kathy Droke is the Director of Public Relations and Communications for Oviedo Medical Center and HCA Healthcare Hospital. Prior to her 7 years with HCA Healthcare, Kathy managed programs and events for the Greater Orlando Children's Miracle Network, raising funds for Shands Children's Hospital at the University of Florida, Arnold Palmer Hospital for Children, and Winnie Palmer Hospital and Women and Babies. Kathy is a two-time UCF alum with a bachelor's degree in organizational communications and a master's degree in nonprofit management. Thank you so much for joining us today, Kathy. How are you doing today?
I'm doing great, Bridget. Thank you so much for this opportunity to give our community an update. As Sean said, people are questioning how we're doing, and it's exciting today to be able to talk about that.
Thank you, and I want to thank all of you for coming. We're going to start with a quick 5-minute synopsis of what you guys have going on with your hospital, and then we'll get into a Q&A. So, Caitlin, why not start with AdventHealth? Caitlin, tell us what's going on with AdventHealth right now.
Thank you, Bridget. So at AdventHealth, we feel we are ready for a surge situation should things start to ramp up here a little bit. We've been aggressively planning since February, and we've made significant investments in our services, our infrastructure, supporting our personnel, and additional technology to be able to provide services and care for our community in this time. The good news is the surge situation looks like it might not be as bad as once predicted. However, we are still preparing for the worst just to make sure that our community is well supported during this time. We know that everyone's looking to our hospital systems to make sure that we're prepared, and should any of you or your loved ones be in our care, know that we're ready to take care of them. You may have seen some things we're doing to be prepared. So one of the things that we've done at each of our locations is actually put a tent at our Oviedo ER, and then outside of our Winter Park ER location, as well as our other facilities. And that's just one example of a way that we would be able to handle additional capacity and to be able to prepare for a surge situation. One of the things that I love about being part of AdventHealth is that we are part of a really large system. So we have hospitals all across Central Florida and even across the nation. So we're able to leverage our size and make sure we are well prepared, and we are able to share resources among the community of our hospitals, and that we can deploy resources to locations who might need it a little bit more. So we're really working together across our whole entire system to make sure we're not just looking here what's happening locally, but across the regions and the nation as well. We've taken a lot of measures to make sure that we're ensuring the safety of our team members while they're here, as well as the community. One of the things we've done is to eliminate our elective surgery, so we can save on our PPE and make sure that we have those if we should have an influx of patients. And then we're restricting our visitor access to make sure we're controlling who's coming in and out of the hospital, and that we're temperature checking our employees and providing that level of care for them as well. And one of the things I wanted to bring to attention is we've heard in the community there might be concern about coming to an emergency department still in this time because of fear of coming in contact with somebody who may have COVID. And I definitely want to reassure the community that hospitals are working really diligently to identify and isolate those patients as quickly as possible, and so that our ERs remain safe to those having other emergent situations that are not associated with COVID. So please don't delay in getting emergency care if you should need it in this time. Hospitals are safe, and I think we're all ready to be able to care for you, and that's kind of our broad update for you.
Thank you so much, Caitlin. I appreciate that AdventHealth update. And let us move on to Orlando Health. Sean, would you like to give us a quick update on what Orlando Health is working on right now?
Yeah, sure. And much like Caitlin said, so first off, one, just, thanking all, obviously, first responders and everybody in healthcare, right now, all the systems, everybody, we're working together. And honestly, every week, all the CEOs from all of the hospitals within Seminole County, we actually talk. We get on a call together and we talk through to make sure that, if there is this surge, that we're prepared together to work as a region. I think that's been really cool, and just sharing ideas. And again, because at the end of the day, it's to protect our patients. The other I want to thank is the school system. I don't want that to be lost, and we thank first responders and healthcare, but for the health system, or for the school system to put together what they did in such a quick fashion, it was amazing. And I know all three of my kids have said now that they are ready to go back to school. They miss school. And I never thought they would actually say that. And when I talked to the principal the other day, she said, I can't believe how many people have actually said that, and hope that teachers get the kind of the credit that they have been due for so long because of all the work that they're doing. So what I would say is, we've been in different phases, right? So we've been prepared. We've been watching everything. We actually developed kind of our own model within Orlando Health, taking a look at 4 different county system that we take care of patients all day, every day. And basically looking at national models, international models, and then how does that go into, excuse me, how does that go into what we're seeing? And so our models, just like I know everybody else's, are showing actually week by week, even lower than what was expected at the low rate. And so again, same token, you don't take your foot off the gas pedal. You have to be very careful, but I think everybody remains prepared. But I think Caitlin made a good point, is that, we are talking to our physicians, we're talking to patients, and there's this fear, in terms of, hey, I need to stay at home, and I don't need to get the care that I need. And we don't want that message to be overshadowed, because there are patients that still, have heart issues. They have other healthcare ailments that they need to take care of. What we don't want is to go through this, and then we find that we have a lot of folks that need a higher degree of healthcare than they would have otherwise if they just had sought the care that they needed. Hospitals, if anything, right now are probably the safest place, because we are, just like Caitlin said, we early on went to masking all of our visitors, made a very difficult decision to limit the number of visitors unless there was a specific case. But one of the things that I think that our nurses early on, when we were going through this, it was the unexpected. And when I would round through the hospital and talk with them, they kind of look at me and they said, Sean, we got this. We take care of these patients all the time. We see flu patients, we see highly infectious patients. We've always been trained on how to use PPE and again, take care of these patients the way that we know how. So I think that's where you've seen these folks, and just trying to educate that our team members that, you're going to see things on the news, the national news of different areas, but the reality is, here's what we're seeing now. And again, we're always going to be prepared, but at the same token, here's the reality and taking care of. And I think that's the the biggest thing for us, is that we've always communicated every day. We have 22,000 team members at Orlando Health. We send a daily team member update. We used to send it twice. Now we send it once a day, even on the weekends. And then we send one to our medical staff as well. And so in those daily updates, we have a question and answer of the day. We have talking about, and we share, we're very, very candid about what we share, but we share, how many patients, we share how many operational beds we have available, how many ICU beds, how many isolation rooms, how many ventilators, how many, stretch beds. We talk about how much PPE inventory we have. They know on hand and how many are ordered and back ordered in terms of N95 masks, level 3 masks, level 1 gloves, you name it. So I think we've just been trying to be very, very transparent in the way that we let our team members know that, hey, again, we've got this, and we're going to continue to do that. The second phase now is really this post-COVID, because let's be real. We're going to have to live through this for a while. So how do we as a health system, how do we as a hospital continue to do that? So I think we're having a lot of those discussions right now, and there's always a lot of lessons that people learn through this. But again, I think my biggest message is one, we're always going to be prepared, take care of the patients. The second thing is it's all about that transparency and over communication. Make sure your community and your team members and your physicians know, because the more they know and the more they're educated, the more they feel comfortable, and it reduces a lot of that stress that many of them are feeling. So that's it.
Thank you so much, Sean. Thank you for giving the update with Orlando Health. And actually, one of my questions, which you had answered, was how are hospitals all working together? And it sounds that you guys are having weekly meetings and really gathering and discussing how you can be the best hospitals in our area, which I feel the same when we're talking about chambers of commerce. Although everyone has their different area and different guests and clients, all of us are coming together right now for the overall good of helping our communities. So thank you for answering that. And we're moving on to Oviedo Medical Center. Kathy Droke, give us an update on what Oviedo Medical Center is doing during COVID-19.
Sure. Thank you, Bridget. And like everyone has said, we are all in this together. But Oviedo Medical Center, in case you don't know, is an HCA healthcare hospital. We have 184 hospitals across 21 states and the UK, and we've been preparing since January. So we've always had the necessary, what people are calling PPE, is personal protective equipment. We have in Florida just shy of 50 hospitals, and we're taking care of probably a third of the state's COVID patients. Fortunately, as we've talked about, the surge hasn't been as high here as we had anticipated, so we're pretty lucky with that. But as Caitlin was saying, one of the advantages of being a national hospital system is that we can take our supplies and move them across the country and have the infrastructure enabled to do that to help our hospitals that are in greatest need. And then today, in fact, HCA announced that we'll be providing 1,000 ventilators as part of the American Hospital Association's collaboration with the federal government and health systems to distribute those ventilators to hospitals that are experiencing the surge. So our company has been really great during this pandemic. We have really taken care of our employees. There have been no layoffs, no one losing their job. They've implemented, HCA Healthcare has implemented a pandemic pay program where if someone is not able to make their hours or get redeployed, that we're able to pay them 70% of their salary for the 7 weeks, March 29th through May 16. If we do have a coworker that is quarantined per the CDC guidelines and works in a patient care facility, they'll receive 100% of their pay while they're quarantined. We also have implemented a scrub, we launder their scrubs if they don't want to take them home in fear of bringing that COVID home to their loved ones. We have free hotel for frontline workers if they need it. And then, of course, all the other things that we've always offered as far as mental health help and telehealth. And then HCA senior leadership has committed $2 million to our Hope Fund, and that is a grant that we can give to an HCA employee if they have a demonstrated financial need. So HCA is really rallying around our employees and taking good care of us. At Oviedo Medical Center, we have been very fortunate. We've had no staff exposure, so none of our staff have had to be quarantined. Like the other hospitals, we went on universal masking procedures pretty early on. In relation to the Seminole County and the state, we implemented the no visitor policy, except as in a few extreme instances. We take temperatures for every person that walks in the building, very rigorous screening. Also on our website at oviedomedicalcenter.com, we have a resource hub that a lot of people are having that on their websites right now, but we have tips for preparedness and tips for social distancing, and then there's also an assessment chat box. So if you think that you may have COVID, you could actually go online and answer the questions to see what your to assess what your needs are. We're in daily communication with each other. We have our daily briefings, and then of course we have our daily communication with Oviedo Fire Department, so they know exactly what's going on in the community. Our morale is really good right now, which is key, as the others will tell you. Our morale is good. As Sean said, our nurses are ready. This is what they do. We feel like we have what we need and we're being taken care of. We have a PPE steward who actually makes sure that our employees have the equipment they need and that they're wearing it properly, which of course they're prepared. Our nurse educator created a rejuvenation station in the hospital so that anyone that needs a snack or a place to go can just kind of hang out and get some refreshment. And then, of course, our community has been absolutely incredible in supporting us. If you've followed our Facebook page, you will see all the very many food donations that are coming in. Our chamber members have really taken care of us. Metro Diner, Dominic's Restaurant, Rock and Brew, Stefano's. And then, of course, our community itself, we had a group from the Nextdoor app get together, and they came around the hospital and flashed their lights, and in relation with Oviedo Police Department and Fire Department, they flashed their lights and honked their horns, and just everybody within the hospital felt really, really appreciated, so that was fabulous. This week we received 100 cards and letters from the kids at Redbug Elementary School. So, I mean, we feel the appreciation. We know that people are there and care about us, and it's pretty exciting. One thing that we've seen that I wasn't expecting is we've had a big influx of babies this month. A lot of moms are delivering their babies at Oviedo Medical Center, and of course our Memorable Beginnings unit has a 5-star rating, so it's kind of been fun to see all these babies going home in the midst of this crisis. So we're definitely, as Sean was talking about, we're definitely not seeing as many people through the Oviedo ER as we were before, and we definitely want to make sure that people understand that the ER is a safe place. People are still sick, they're still having strokes, they're still having heart attacks, but they're not coming in as soon as they should because they're a fear. And the ER is one of the safest places to be. I mean, we're taking every precaution we can. And again, as I mentioned, we've had no exposure to our staff. So final note, we're prepared. We're here for you if you need us. And practice patience. Check the CDC website. And I appreciate everybody listening today.
Kathy, thank you so much for your update with Oviedo Medical Center. I found a couple of those points very interesting. People are concerned about going into a hospital just because hospitals, people are like, well, they're sick or they're, going through something and I don't want to get COVID just because I have back pain. So, you know what? I'll just skip it. I'll be okay. I'll make it through without going in the hospital. And it does catch up. And I do believe that it's nice for you guys to reiterate that hospitals are, they've done this. They've kept their areas clean. They know how to do it. They have the supplies. They have the experience. They have the nurses. And even though the COVID-19 is new to us, it's not that hospitals have not gone through these types of diseases before this. So that was a great note. Kathy, you mentioned Stefano's. I also want to thank Stefano's. They are generous enough to donate a meal to one of our heroes, and I'm talking about one of our nurses, doctors that are working, and one of our administrative staff that are working in a hospital. So we're going to coordinate that afterwards, but I definitely do want to give a plug to Stefano's Trattoria for that in Winter Springs. They are amazing, and thank you for recognizing some heroes in our community. So let me get to some questions. One of the first questions I had is, everyone's talking about this testing, where we know that there's testing areas opening up at the Orange County Convention Center. We have them at the UCF now has one, but it's by appointment only. How are the hospitals, are they working on getting more testing open? Is that done with the hospitals and in conjunction with, or how does that work? And if anybody could explain a little bit more about testing and if it's going to ramp up for us in this area. It looks like Caitlin unmuted herself.
Yeah, I'm happy to start if you'd like me to. So testing is so important because it's hard to treat what we can't see. And so with testing, we gain a lot of knowledge and understanding on what areas might be impacted a little bit more. We've been able to see the benefits of social distancing by seeing how that's impacting and the negative tests that are actually coming back. So I can tell you, at least for AdventHealth, we have opened up 2 drive-through testing locations. One of them is at the Daytona International Speedway, and then the other one here locally in Orlando is at the Mall of Millennia. So these 2 locations are for anybody who is well enough to visit, but still having some symptoms to go and to test. You don't need a doctor's order to be able to go there. The lines have been pretty short, so we have a lot of capacity. It's a quick way for people to get in and get tested. And then each of our hospital locations are able to test as well. We have acquired 3 specialized testing devices for our labs at Orlando, Daytona, and Tampa, so we can have some quicker turnaround times and not relying on some of the public agencies for some of those testings. All of our hospital sites as well as center of cares can test for COVID as well.
Thank you. Adding to that?
Yeah, I'll add it to Kay. So since Caitlin talked about a little about the community, I'll talk about kind of the in-house. So I think one thing for all the members to realize, one of the things that didn't get talked about maybe early on, she touched on it, but when you think about, it's a specialized test, right? And one of the biggest things that we knew with the number of unknowns, and again, you can say this for any health system, is, you have a patient coming in, you classify them as this, if they meet the symptoms and they, kind of meet the screening, you consider them, kind of this person under investigation, right? A PUI, because you don't know, you assume. And so you take all these precautions and, then that's where your PPE and your negative pressure rooms and all the things, but it'd be really nice, not only for our team, but also for the patient and the family and everybody else to know, hey, am I negative? Am I positive? Because I think early on, we saw a lot of patients that were not sick enough to be admitted to the hospital, but they were sick enough to go to say a freestanding ER or an ER to where they were discharged back home waiting for a test and told, hey, you need to isolate. And so early on, I think everybody across the country saw, oh my goodness, this is taking, 3 to 4 to 5 to 6 to 7 days. And that's very difficult for, say you've got a spouse that is then, over in the corner in a room or in the house. It's just very difficult, plus you're waiting. And it's the same thing if a patient was an inpatient. Again, you're waiting to get those tests. So early on, we were concerned. And so we moved to an in-house testing to where we had a certain capability per day and, moved away, honestly, from some of the outside folks that we had in the past to the point where we were getting results within, a day. And that helped us to be able to, with a high probability, high sensitivity, et cetera. So we were able to then know beyond a shot of a doubt and get those results back out to our patients and team members, et cetera. And I think now, I think everybody's starting to get caught up to be able to do that. Now we're in this process of, hey, we've got that capability, but then there's this new test through Abbott that gives you really, from the time that you actually test, the time that you get the longest time, 30 minutes. It's helping you get these rapid tests about, what the FDA is allowing you to do. And I think that's what we're gonna, as a society, start to do more of, is the ability to people feel more comfortable to have certain procedures, to feel comfortable knowing that, hey, they're negative, et cetera. So I think it was an unspoken that people across the country, I think you heard that in different parts of the country where it was such a backlog. I know at one point early on, we had heard when, Mayo Clinic is used quite a bit, and obviously in Minnesota as a reference lab for hospitals, they were, trying to do over 1 million tests per day. And so then they had to send them out to different places. And so I think we took it on early on to say, hey, we want to have control over these tests to be able to get the results back to our patients, our doctors, et cetera. So I think you're going to continue to see more and more technology that comes out that has those rapid tests. And it really just does, it helps everybody.
Thank you. Kathy with Oviedo Medical Center, if you didn't want to add anything, I have the next question and I'm going to continue on with you. Would you like to add something or should I move on?
You can move on.
Okay.
John summed it up very well.
Kathy, are they allowed, and Kathy's with Oviedo Medical Center, are they allowed to give up any COVID statistics in their hospital systems? And I'm assuming this is kind of like a HIPAA question. Are you guys able to do that working at a hospital?
I mean, as far as statistics, how many patients we've seen, I don't have that number. Sean, as President, maybe you've got a number that you can share. I don't have that number. I can tell you daily, it's less than half a dozen daily that are in the hospital.
Yeah, I think it's a moving target, obviously,
Yeah.
but I think with Orlando Health, one of the things that we do put in our team member emails is just the number, and we look at it more of, hey, this is the number of positive inpatients we have, and then the number of rule out inpatients pending, and then the number of ventilated patients, how many are positive and how many are rule outs. And, because we just got the sense that, again, I'm going to be very transparent early on, when you go up and you talk to your team members, the nurses, supply chain, everybody, environmental services, food, nutrition, honestly, we cannot underscore the fear of the unknown, right? And it was just, you just didn't know. Your barometer was Italy, your barometer was China. And so I think trying to prepare for that, but at the same time, be very, very transparent and honest. And so we made the decision to do that, to let them know, because I found early on, I could be as transparent as I want. When I would go up on the nursing unit and they would say, hey, I see these stories about people not having enough protective equipment, PPE. And I got to the point where I said, no, I've seen the inventory, we're good. And Dr. Jamal Hakim, our COO, who's an anesthesiologist, really was the one that said, we got to do better than saying we're good. We have to be transparent. So we made a decision every day to say, this is exactly how many we have in terms of on hand and ordered, et cetera. And we took that as an opportunity to say, guys, we're going to let you know exactly what we've got. So to answer the question numbers, again, I can't give specifics in terms of, I don't have it in front of me in terms of the actual number. I can tell you that we have seen more patients not in kind of this area, maybe even downtown, but more in, say, Lake County, and I think it just depends upon, and obviously too, at our Dr. Phillips facility, when you just look at the size of the number of patients that they see, but also, the number of international travelers that they have, being in that area. So I think every hospital is different. I can tell you, we've seen more patients actually come to the ER, the freestanding ER, and saying, hey, I think I've got it, and they're tested and they are positive and they're quarantined at home, than we have per se, actually were so sick that they need to be admitted or even, on a ventilator in the ICU. And I don't know the other organizations' thoughts on that, but I think that's kind of what we're hearing.
Yeah, I was going to say, we are also doing that as far as letting our staff know each day how many vented patients we have, how many COVID patients we have in the hospital, and then how many are PUI, which is the patients under investigation. So it's same. I mean, as Sean mentioned, it just helps our staff know what's going on. If you're not transparent, then the rumors just start, and you don't want that. You want everyone to know what's happening, that they are, where the patients are, and how well we are protected. So.
Thank you. Thank both of you. What are the health systems doing with their off-site urgent care facilities?
We've got a few of the Care Now in town. I know Winter Springs is closed, and I'm not sure if that's a temporary closure, but our Care Now on University Boulevard is still open and accepting patients if needed.
Thank you.
So at AdventHealth, our centric care locations are still open and accepting patients. Additionally, we have the telehealth options as well. So if maybe you don't have something that you maybe feel comfortable enough going in person, you can download the AdventHealth app and actually book yourself an appointment and do telehealth. It's one of my favorite things to do because I can usually do it in 5 minutes from my office, but it does prevent you from having to go to a location as another option for you, but all of our urgent care facilities are open.
And Bridget, same thing, our care spots, and I think, but Caitlin, I think touched on a good point, is that, you are, I mean, again, you guys are reading this, you're seeing the emergence of what telehealth can do and virtual visits. And so I think everybody has a platform for that. I asked our cardiology office yesterday how that's going. And they said, patients really are getting used to it. At first it may have been a bit cumbersome and trying to figure out how to do it. But once they did it, they said, hey, it's amazing how much time you can save instead of, having to get off work, drive all the way over there, have your appointment and come back. And so I think there will always be a need, period, for face-to-face, interaction with physicians, specialties, et cetera. But I do think once we go through this, you're going to see more of a virtual visit and telehealth platform because it just seems to work for patients. So, but again, I think that's the thing, is that we just got to make sure that people continue to to go to the doctor and get the care that they need. Because be honest, I've heard already too many stories within the community from colleagues and friends, et cetera, where it's that fear of, hey, I'm not going to go to the doctor, I'm not going to get this appointment, I'm going to cancel this imaging appointment. And again, I think that people just have to be very, very careful, because what I can say, and I know certainly with Oviedo and Advent, we are all in agreement. I mean, it's a very, very safe environment in terms of patients coming to receive their care. Nothing's changed in that. I think that's probably the bigger message to get out of the community is, hey, you need to get the care that you need to.
Thank you, Sean. And some positive feedback for Sean. Family friend is currently an inpatient at South Seminole, requiring surgeries yesterday and today. We have heard from them that the treatment they are receiving is not only excellent, but other than restrictions on visitors and other subtle differences, you wouldn't really know there was a pandemic going on. And we will move on to the next question. Arnie asked, is each hospital doing priority surgeries and diagnostic work for long-term chronic patients? Plus, can you talk about antibody testing? How is each system looking at those key tests? I'm going to start with Caitlin on this, and then we'll move to Sean, and we'll move to Kathy, so each one gets to speak on this.
Sure. So fairly early on, we made the decision not to do elective surgeries at our hospital locations, and that was really to keep everyone safe and to preserve our PPE. But certainly if there was an emergent condition or that required surgery, that would be something that we're still doing within all of our hospitals. And as well as chronic patients, if there are tests or other things that they need to do to manage a chronic condition, they are still able to do that, and there should be minimal impact to that type of care that they're used to receiving. And so we definitely wouldn't want to deter anybody from putting off healthcare if it's, to manage a chronic condition. It's just those things that maybe your condition wouldn't worsen by waiting a little bit longer. That would be considered like an elective surgery that we have postponed at this time. As far as the antibodies, so this is actually really neat and something that I know we have started to do, and you can take the antibodies from the plasma of a recovered COVID patient and actually use that to treat patients who are currently battling the condition. And I know that's kind of in its infancy stages being utilized, but that is something that we started to do here as well.
Interesting. Thank you, Caitlin. Sean, can I get an update on what are you doing regarding priority surgeries at Orlando Health and diagnostic work? And then can you talk about antibody testing?
Sure. So first thing on I think the biggest thing for us is that, and this is Sean speaking for a second, but, trying to figure out, as an administrator, not a surgeon, what is elective and what is not, and I think we made the stance early on in conjunction with talking with ACA as well as Governor DeSantis, is that we felt like this did not need to be a hospital administrator's decision. It needed to be a physician decision. And so, there are, I don't know, you get into this topic of, is it elective, is it non-elective, is it necessary, unnecessary? And I think that goes back to my point is I think that I understand why, the governor, the executive order came out in terms of possible surge and PPE and things like that. But again, the fear is that the surgeon, basically going down, and we have defined criteria, obviously they come back and say, hey, this is what we would consider a necessary surgery. And I think very personally, it was difficult for me because I think many of you know, my wife is a colorectal cancer survivor. And, there's certain things that she needs to make sure that she's always going to be okay. And one of those things is a regular colonoscopy. Now, if you look on the CMS guidelines that says, hey, is this elective or not? She would be told, no, you have to wait. And she was told. And I think that was very difficult because it was the message that was out there a little bit. And I worry, that, hey, we have patients that, because it's, hey, we're not going to do these things, what may happen in the future. And so I think that's the thing, is that we're very, very careful in terms of all the things that have been previously mentioned. But at the same time, I just don't know how you define what is considered elective and what is not elective. I think everybody that goes into a surgery, they're electing to have that surgery. And so again, we've just been very, very open and honest with our team. We've been open and honest with our medical staff to say, listen, this is truly a physician, a surgeon to family discussion. And in conjunction, they make that decision to say, yes, we deem this that we need to have this now instead of waiting. So that's where we're at on that. On the plasma, I just think it's very, very cool, you know, that there's this opportunity to help people. And you guys have seen, it was on NBC News that we did have a patient down at ORMC, and it is doing very well. We actually have someone here in Seminole County at South Seminole, and the same thing. They're doing very, very, they're getting better every single day. And I think, again, it just speaks to when you get people together, smart people together, and how they're able to say, hey, what if we were able to do this? It is absolutely amazing. And I think what can never be lost in all this is we talk about these technologies and these things, but at the end of the day, there's a patient, there's a family behind it. And I think that's probably been the most emotional thing, is that when you see these families and you see these patients and, you know, maybe not a lot of hope at the moment, and then all of a sudden something like this comes along and it all works together and you start to see improvement and you watch the family. That's what it's all about. And so our hope is that I think that with One Blood, who we worked with the FDA, I love the fact that people are willing to say, hey, you know what, we're going to go through all the regulatory things we need to, but we're going to make this a priority. And it's not going to be bogged down of, hey, we'll get back to you guys in 2 or 3 weeks. I think it's great, and it is the essence of everybody working together for the betterment of the patient and the community. So I think you're going to see more and more, I think, of people that are saying, hey, I want to donate. I have a very good friend that came, you know, said last night, hey, I know someone that has had this, they wanted to donate. And I think it speaks to their character and their willingness to help others. And I think you're going to continue to see more and more of this type of procedure happen. And I think the results will continue to speak for themselves.
Thank you, Sean. And Kathy with Oviedo Medical Center. Is each hospital still doing priority surgeries and diagnostic work? And then moving on to talking about antibody testing.
As far as surgery, I mean, Sean really did sum it up great. We are still doing surgery that's necessary. You know, you never know what's going to come in through the ER, so we do still have surgeons in-house. Again, the elective surgery, I know that the surgeons they're wanting to get back to work, but obviously we're following all the guidelines that we need to as far as what we're allowed to do and not allowed to do. We've been able to redeploy our staff to do other duties in the hospital. So everybody's there and ready and waiting for when this passes and we can start seeing an increase in the surgeries. But right now, our imaging department is open. Everything's open because, again, you don't know what's going to come in through the ER and what you're going to need. So yes, if there's a need for something, and as Sean said earlier, you know, I mean, people are still sick. They still need their dialysis. They still are having chest pains, and they need to come into the ER and to be seen so that it doesn't get worse, you know, and they come in a little too late. So that's my biggest thing right now, is just making sure that people understand the ER is a safe place, as we said earlier. As far as the testing, I don't have information on that. I apologize, but I can probably find something out and get back to you guys on that.
Well, let me ask you this next one then, Kathy. In regards to preparing for surgery and keeping patients at home and out of the ER, avoidable hospitalizations, what steps are being taken to educate discharging patients on the need to allow community home health partners to come into their homes and help treat?
So the question is, what steps are being taken upon discharge?
Yes.
So we've got, you know, our case management is involved in every person that's discharged. There's always going to be the nursing and the physician instructions. They're going to be talking about distancing and quarantining and face masks. And I mean, they're going to give the advice that we're giving to everyone when they go home. Sorry.
Thank you. And it must be nice to have babies being born in your hospital and giving that bit of cheer with everything that's going on. So breaking it up with some happiness. And Kathy, it sounds like that's a great part of being able to work at a hospital, is being able to have those moments of cheer and joy through COVID-19.
Yeah. So we have a 6-bed labor and delivery unit, which feels small, this past couple of weeks because we're overflowing, but we definitely have a plan for all those extra rooms that we need. We have our mom and babies are on the 3rd floor, our ICU is on the 2nd floor, so there's a distinction between staff, obviously, and then also space. You know, as far as the COVID, we've had no issues with contamination. Our babies are doing great. Our L&D rooms are LDRP, so they're labor, delivery, recovery, and postpartum all in the same room, so baby stays with mom, and they're just doing great. But like I said, we've had an increase in the babies the last couple of weeks that's been just a lot of fun to see.
Thank you. And this looks like it's going out to AdventHealth. So Caitlin, what restrictions are being placed on visitors, spouses for women giving birth?
Sure. So kind of like Kathy had said, we're actually quite busy with our babies over here. And actually the other day, within 24 hours, we birthed a kindergarten class. So we are expecting probably in about 9 months to birth several other kindergarten classes. But it is one of the joys that we're focusing on right now, you know, and the positive things. But as far as visitor restrictions in general, we, of course, for end of life or special circumstances, we are evaluating those for visitors. Anybody having a procedure is allowed a visitor, and then as well as women giving birth can have somebody with them as well.
Thank you. And it looks like we've been catching up on questions, but this is a question I tend to ask anyone who's on a Zoom meeting. When was that moment that you realized everything was going to change? Where were you? What were you doing? What information did you receive? Caitlin, let's start with you.
Oddly enough, I think when you work in healthcare, you're kind of used to preparing for the worst. You know, we drill several times a year preparing for a hurricane or other disaster type situations. So when this first started, it kind of felt a little bit like a drill in that way, because we're so used to preparing for the worst possible situation that could happen, because we know the communities really rely on us. So I think for me, it didn't really sink in on everything that was happening after. I think it was my first time in a grocery store last week, because I was taking advantage of the people who would shop for you and then bring it home to you, but I had to run out really quick. And so it was the first time, I think, that it hit me, because I was in the community and I was able to see what the community is seeing, versus having the benefit of working in healthcare and having resources and understanding what is truly going on and being able to ask questions to colleagues who I trust, realizing the public doesn't necessarily have that ability all of the time. So for me, it was my first time actually kind of being a public community member and seeing everybody with their face mask and the little stickers on the ground to keep you 6 feet apart, that I realized that our world has just changed so much. And I think it was really humbling for me to be able to put myself in the perspective of our community and to understand that not everybody has the knowledge that I have. And so if I can in any way give peace or ease somebody's mind because of how well I know that we, as well as the other hospital systems, are prepared, I think that's something that gives me a lot of peace, and knowing that and if I can share that as well, and you know, we're ready, and so we're here for you.
Thank you. And that's a very interesting perspective. It's sometimes difficult for us to put ourselves in other people's shoes, and when that reality does hit, it can be shocking, and you know, you take a step back and realize what is going on in other people's lives. And I've dealt with that in my line of business. I know I get phone calls of businesses knowing that they're not going to be opening back up, or employees that were, you know, ambassadors of ours that no longer have a job. And it's very, very real, and you do feel the weight of the community and the devastation that is going on. So thank you for sharing that moment with us. Sean, when did you have that moment of everything is going to change, and what were you doing? Where were you?
Yeah, I think much like Caitlin, I think there's, you know, let's be honest, there's the professional side of all of us, and then there's the personal side, you know, and I think that the professional side, when you're in it every day, you know, and that's kind of what sometimes breaks my heart, is when you're together as a team and you're, hey, we've got this, we're prepared. We do this all the time. We prepare for hurricanes and things like that. Even though when I moved down here from Tennessee, people told me we didn't have hurricanes, and I learned that no, that's not the case. So they're still giving me a hard time on that. But we prepare all the time. But I think the hard part is talking with family and friends and things like that of, oh my God, what's going on, how bad is it? All those different things, because again, the unknown, also it's perhaps.
You're cutting out a little too. I'm not sure.
Is that better?
Yes.
Okay. So basically, I was just saying that, again, for all of us and everybody watching, I mean, there's the professional side of us, and then there's the personal side. And I think the professional side, again, you're in it every day. I know all of us have been on 7,000 billion conference calls that that's pretty much our life every day, and having incident command and things like that. But I think what, for me, my mom and dad moved down here. They live at Oakmont Village, in Lake Mary. And, for me, it was, hey, and they did everything they were supposed to. They protected their residents. And so they were not allowed to leave, and they were not allowed to come and go. And so, not being able to see my parents and wondering, how they're doing, that's been hard. It's been hard on them not being able to get out and resume that normal lifestyle. And same thing with the kids, trying to adjust. And I think, here we talk a lot about, what is going to be that new normal, but also the word that I hear all the time is adapt. I think everybody is just adapting to what that is. And I think that's the beautiful part about, at least for what I've learned, Central Florida and certainly Seminole County in general, is that it's folks like you, Bridget, and others, to where we're all staying connected to the best of our ability, because we do need each other. The businesses need each other, the healthcare organizations need each other, and that's what makes up a special community. And I think we've all got things where we can learn from each other and we can offer. I've got, you probably wonder if I have a ghost in the room. I've got Megan Almasi, our community relations person, with me, because, she has tied in, I love what she does in her role, because it's the face of kind of that community, and people wanting to step up and donate masks and this, that, and the other. And I think that's the thing. If we can just together continue to educate each other and communicate, kind of what this new norm is going to be. I think everybody, let's be honest, everybody wants to get back to, as soon as possible, the most normal that they can. We have a really good friend that her daughter, is a senior in high school, and, not having the prom and not having, the things that she was looking forward to. And at the same time, she understands that, this is a very serious thing. And then there are people who have passed away. There are very, very sick people. So I think that's the thing, is just staying connected, and learning and educating and communicating as much as you can, to where we can start to get back safely, but as we can continue to get back to where we were as a community, and being strong in doing so. And I think that's the thing. We've always used the phrase, we're not going to fear this. We're going to remain vigilant, but we're not going to fear it, and I think that's the key that we just need to continue to communicate.
Thank you so much, Sean. And Kathy, Oviedo Medical Center, when were you? When was that moment that you realized everything was going to change?
So for me, it was in the hospital when, we're a small concierge type hospital. We have family members coming and going all day, every day. And when we went to no visitors, that was the moment that I thought, oh my, everything really is changing. To lock your front door and have only one or two entrances open, and to not allow those visitors in was really hard for me. We all have our personal stories. I have a mom who's battling lung cancer, and I couldn't imagine if she was in the hospital and I couldn't see her, I couldn't be with her, I couldn't, we had one young lady was standing outside in the parking lot with a sign, holding it up to her grandma, her Nana, in the room. So that to me was when it was real, and when I thought, what is going to be our new normal? We don't know what our new normal is going to be. So, like the others, I don't think I haven't watched any news. Thankfully, working in healthcare, we've been getting our updates through our healthcare system, through the CDC. So we don't have that hysteria. As Sean said, we're prepared, and so we don't have that same level of fear that some of the public has. But I'm just, I guess, cautioning patience. Let's make sure that we're ready to reopen things, and just be patient, and we'll get through this together, again, to see what our new normal will be. So.
Thank you so much, Kathy. I want to thank our whole panel for coming out today. We had Caitlin Janitzko with AdventHealth, Winter Park. We have Sean Molsberger, the president of Orlando Health South Seminole Hospital, and we have Kathy Droke, the director of public relations and communications with Oviedo Medical Center. Thank you guys all for being here today. Really appreciate the update, and I'm sure we will be talking soon because this is something that we need to stay regularly updated on when it comes to our healthcare system and our hospitals and what is going on. Thank you guys so much.
Thank you.
Thank you for the opportunity.